Okay, so chapter 5 is cultural awareness, and this is a long and very important chapter for your own knowledge and not necessarily for NCLEX. There are only maybe a few questions on this stuff, but it is crucial for your own practice. What's appropriate and what's not when it comes to communication, when it comes to customs, health, etc., is super crucial. Just to keep in the back of your mind as you're treating your clients. You don't want to be judgmental. You don't want to be belittling of someone's culture and customs. So this guide is really basic. It does not cover everything, not even close. So here we go. So African Americans tend to have a large extended family. Religious beliefs and church affiliation is usually very crucial. Nonverbal communication, body language is important. Flexibility and avoiding rigidity while scheduling care, and this goes for a lot of different cultures because maybe there's a tendency to attend to family needs before their own care. And here's a note on mental health. This is not in the Saunders book, but I think it's a really crucial piece of information. So African Americans are less likely to seek out treatment for mental health issues and more likely to end mental health treatments prematurely. Perseverance and resilience is highly valued in their cultures, which are great traits, but it's really important to listen attentively and offer support because of the mental health stigma in their culture. So health risks include sickle cell anemia, which is a question I have seen on the NCLEX, hypertension, and heart disease. Amish. There are fewer risks of disease because they abstain from tobacco and alcohol. Their social roles, it's a patriarchal society. They often don't have health insurance because it's a worldly product and may show lack of faith in God. At death, a woman is usually buried in her bridal dress. Health risks. Genetic disorders, because there is a prevalence of inbreeding, non-immunization, and sexual abuse of women. Asian Americans. Eye contact can be considered disrespectful. Head nodding doesn't always mean agreement. No touching during conversation. I have seen this question as well. The head is considered sacred. Also seen that question. It's a patriarchal society. They might be less dramatic about health issues, but it doesn't mean that their issue is not serious. So after death treatment and care. So for Hinduism, the body is generally not washed. So if you're working in like palliative care, this can be really crucial to know. Tying a thread around the wrist, sprinkling the body with special water, and putting a basil leaf on the tongue. And Buddhism, you want to make time for meditation at the shrine. That can be important to the families. The client may refuse meds that alter their consciousness. So opioids, things of that nature. And after death, a monk may recite prayer for 1 hour. Health and illness. In Asian American culture, health is really considered a state of physical and spiritual harmony with nature and the balance between positive and negative forces, and these are kind of known as yin and yang forces. So oftentimes when someone is sick, they will use food to restore health. That's what they believe. So if there's like a cold illness or a warm illness, which is how they tend to categorize illness, and there are also other categories as well. They might use yin foods, which are cold foods, for hot illnesses, and yang food, which are hot foods for cold illnesses. So alternative modes of healing, this is crucial in Asian culture. Herbs, acupuncture, massage, restoration of balance with foods, like I said, and more. So very holistic modalities. Health risks include hypertension, heart disease, and cancer. Hispanic and Latino Americans. So there's a tendency to be verbally expressive, yet confidentiality is important. Dramatic body language can express emotion or pain. Extended family networks are highly regarded, and needs of family over needs of individual members is crucial, just like in the African American community. Strong church affiliation and Catholicism is common. Health risks include hypertension, heart disease, and diabetes. Native Americans. So there is linguistic diversity, so the use of an interpreter is really important and common. Silence indicates respect in some groups, and this is a pillar of therapeutic communication, so you should just know this based on what you've learned about that, but it's especially crucial in Native American culture. Some members speak quietly or in like a low tone of voice and expect others to be attentive. Elders are honored. Sacred myths or legends provide spiritual guidance for some groups. So their top 3 health risks are a little bit different. The first is alcoholism, and then obesity and heart disease. White Americans. Eye contact can be viewed as trustworthiness, which is sort of the opposite of Asian Americans. Handshakes are commonly used for greetings. Nuclear family is the basic unit, and the extended family can also be important. It's a patriarchal society. So health is viewed as the absence of disease. Health risks are cancer, heart disease, and diabetes. So Catholic or Orthodox are the priest anoints the sick. Mormons, sacrament may be administered if the client requests it. Protestant, prayer is common. For Jehovah's Witness, and this is very important, I see this question everywhere, they're not allowed to receive blood transfusions. Islam, client may choose to face Mecca, which is southwest or west in the United States. The head should be elevated above the body. Discussions about death are usually not welcomed. Grief may be expressed through hitting or slapping the body, and only same-sex care for handling the body after death. And this goes for care generally in Islamic culture. Usually they want the same-sex practitioner. In Judaism, the dying person should not be left alone. A rabbi's presence is desired, and autopsy and cremation are usually not allowed. Okay, so that was kind of a lot of information. Like I said, there really are not a lot of questions on the NCLEX about this, which is sort of a shame because I think it's pretty crucial. A lot of the things mentioned, it just does not go for every family. This is just kind of the typical way things are. Whatever belief someone has, even if you don't agree with it, it's really important to just be respectful and honor it, especially as a nurse. Outside of your profession, you can protest whatever you want, but when you're with a patient and they have some belief that doesn't fit your idea of reality, the best thing you can do in that situation is maintain a non-judgmental attitude, kindness, and respect for them, because they will be more willing to trust you and open up to you and actually give you details about their lives that can be really crucial in their care. So it's all about providing the best patient care at the end of the day. So I mentioned that in the Amish culture, sexual abuse is common. These things are crucial to report. So that doesn't mean that you're judging your patient by any means. They might have grown up in a society where some things were typical and normalized that shouldn't be. So it's really crucial that you as a nurse are a resource and part of that person's support system. These are cases where it's especially crucial to be respectful, to offer advice, to offer resources, to let the patient know that it's not their fault. Thank you so much for joining me for this chapter. And I really want to know in the comments how your culture differs from how Saunders describes it, because I know Saunders, it's really just scratching the surface and it's pretty stereotypical things about cultures. Like I said before, not a lot of this information is on the NCLEX, but it is really important to know just generally with your patient care once you're a nurse. And please like and subscribe for more videos just like this one.